When you first start the process to have gastric bypass surgery, they really go over everything that covers the surgery, from your needs before the surgery, what's involved with the surgery, and what's going to happen after the surgery. When you meet Dr. Ben Meyer for a one-on-one consult, he takes his time with you and he explains everything about the surgery you're going to have. At St. Vincent Charity Medical Center, we're fortunate that our surgeons have each performed more than 2,000 weight loss operations, and the program itself has performed almost 7,000 weight loss operations. But additionally, the team that'll be helping us perform your surgery is there every day. It's a consistent team. Typically when a patient comes in to the office to meet with me, we'll spend the first 15 minutes learning about the patient. I'll ask you a bunch of questions so I can get to know you better. Then we'll talk about the 3 different weight loss operations that we perform at St. Vincent. And then we'll talk about which operation speaks to you, which operation seems like it's the best fit for you. And then together the two of us will decide whether that is the best choice for you. I think of these 3 operations as tools, and I think of the gastric bypass as the most powerful tool that I have to offer patients. On average, patients lose about 65 to 80% of their excess weight with a gastric bypass over the first 12 to 18 months. A gastric sleeve, with a gastric sleeve, the weight loss is also over the first 12 to 18 months. Patients average 60 to 65% excess weight loss. And a laparoscopic adjustable gastric band, the weight loss is gentler. It takes about 2 to 3 years to lose the weight, and on average patients lose 40 to 50% of their excess weight. Performing surgery is a team effort. It takes more than just the experience of the surgeon.
I see patients before and after surgery. I help prepare them for how life is going to be for after surgery. In a nutshell, I arm them with the information that they're going to need to be successful after surgery and long term.
Patients that are interested in pursuing bariatric surgery at St. Vincent's are in the unique position of having a patient advocate.
I help patients deal with the insurance companies by being the liaison between the two, helping them get all their requirements by making the phone calls to the doctor's offices and the psychological offices to get all the paperwork so they don't have to do it. The staff here at St. Vincent Charity Medical Center has been phenomenal. They've always been here for me when I've had to call them if I had any problems or issues. They always called me back immediately, and they always made me feel like I was their only patient and like I was special. Patients can learn more about weight loss surgery by clicking on our website, stvincentcharity.com, and then looking at the Center for Bariatric Surgery. We have an online seminar called our webinar. If somebody came up to me and was asking me about the weight loss surgery, I would suggest to them that they attend a seminar, that they can go to the St. Vincent Charity Medical Center website to look at the seminars that are listed, that they should attend a seminar, and then after they attend the seminar, they can call up and make an appointment over here at the Bariatric Center. To see the patient 6 months down the road, it's amazing.
You know, when they come back after they've had surgery, just to see the change.
Physically and emotionally doing fantastic, and it's just a great feeling that you had something to do with that.
I love making a difference, and I'm glad to be a part of it.
Well, it's fun to come to work. There aren't too many other fields in medicine where you can improve quality of life so dramatically. Not too many doctors can say that they cure diabetes or cure sleep apnea or cure high blood pressure. And I know that within a year of surgery, 86% of my patients won't have type 2 diabetes. 80 to 90% of my patients won't have sleep apnea. So there's so much positive reinforcement as a bariatric surgeon.
I love my job because I like seeing the patients from beginning to end and thinking it's going to be a long, drawn-out process, and they find that it's actually smooth, and they're greeted with honesty and assistance, and at the end they achieve the goals that they wanted to achieve, and that's the weight loss, and they're happier and healthier.